Well, 15 to 1. We'll be back on Channel 4 without William over the summer.
Right, now, it's time now to meet a young girl called Jessica. Jessica, are you ready for your close-up? Nice big smile. Here we go. Lovely. Perfect.
Oh, what a beautiful girl, isn't she? Well, Jessica loves school and she loves sport, but recently her life changed dramatically.
Jessica is a lovely girl. Everybody loves her.
10-year-old Jessica Ansong loves swimming and schoolwork. She's a little girl with big ambitions.
She likes netball
and basketball.
She says she wants to be a police officer.
History and PE.
She wants to be a dentist.
Art and English.
She's active, yeah, outgoing, yeah.
But just before Christmas, Linda, an assistant midwife, noticed something was wrong with her daughter's back.
Physically, you could see the shoulder blade protruding out. It's not straight, the shoulders are not the same, and that is causing a lot of pain for her waist as well as her shoulder. And then all of a sudden, you know, you spot something like this. It's very worrying and very upsetting.
Jessica's world was about to turn upside down. X-rays revealed what even Linda's sharp eyes couldn't see. The top of her daughter's spine had twisted through nearly 75 degrees.
Doctors here at the Royal National Orthopaedic Hospital in Stanmore diagnosed scoliosis, a progressive and potentially devastating curvature of the spine that seriously affects as many as 3 or 4 in every 1,000 children.
In 80% of children, the cause of scoliosis is unknown. But in Jessica, doctors have identified a spinal abnormality, which only became evident with her recent growth spurt.
In her case, she has got some extra bones on one side of the spine, and the other half of those bones are absent on the other half of the spine. So one half of the spine grows faster than the other half of the spine, causing a scoliosis.
This is me in bed in hospital.
Within just 12 weeks, Jessica's spine had started restricting her lungs and her everyday life.
I wake up in the middle of the night and tell my mum that it hurts.
Without surgery to straighten her spine, Jessica's outlook would be bleak.
Spinal surgery is never an easy option. And until last year, Jessica would have faced a whole series of invasive operations. The first, to fix her spine with a metal rod, and then more surgery every 6 months to keep it straight as long as her back was growing. And that could be years.
But today, a truly ingenious piece of biomechanical engineering means specialists here at Stanmore can fix Jessica's back in just one 90-minute operation.
So this is the rod that the surgeon inserts into the patient. In this area you have a hollow magnet, and it spins around in a magnetic field that is generated externally, and this then drives a screw which then pushes this rod outwards. So this implant is able to keep pace with the growth of the patient.
This is the heartbeat machine, and this is my mum and Mr. Naughty.
Instead of facing as many as 10 major operations, the rod in Jessica's spine will be lengthened by remote control.
Imagine this rod sitting in the muscles next to Jessica's spine. She comes into the clinic, she lies on the table and stretches herself as much as possible. Once she does that, we put this magnet against her skin here and we press this button. Each revolution that you hear means that the rod is elongating by 0.1 of a millimeter.
Teenager Lauren Moss was one of the first patients in the UK to have this surgery. She now comes in for a 5-minute outpatient appointment every 6 months.
So we have lengthened you, you can get up.
It felt quite funny, it felt almost like clicking and popping, but it didn't hurt or anything, it just felt a bit odd.
It's amazing new technology that will hopefully transform Jessica's young life and see her standing tall again.
And what are you looking forward to when you're better?
Going to school, seeing my friends, and the new me.
And we'll see Jessica having that groundbreaking surgery later on in the programme.
And we know that she's fine because she's with us tonight, so that's lovely.
In the meantime, time to see how Jessica is getting on as she prepares to head to hospital for groundbreaking surgery.
Yes, Jessica's spine is twisted through scoliosis, but a brand new bit of technology could help to change her life.
Jessica, we have to pack.
It's a big day for 10-year-old Jessica Ansong. She's about to have groundbreaking surgery to straighten her twisted spine. Her mother, Linda, is doing her best to put on a brave face.
I'll be praying for her, and I'll be praying for Dr. Norden and his team. I know Jessica is in good hands.
Jessica suffers from a condition called scoliosis. In just 3 months, her upper back has bent through 75 degrees, leaving her stooped and breathless.
Anytime I'm sitting down, I go diagonal. The way I am now is not my actual height.
Let's get going. Okay, see you, house.
Traditionally, Jessica would be facing a whole series of operations right through her childhood to keep her spine straight as she grows.
But today, doctors here at the Royal National Orthopaedic Hospital in Stanmore are going to be using a new technique that's revolutionising scoliosis treatment.
They're going to implant 2 magnetic rods to straighten Jessica's spine, then keep it straight as she grows by magnetic remote control.
This rod is lengthened by an external magnet and can be lengthened in the outpatient setting, have it done in 1 minute and go back to whatever it is they were doing. Let's go, guys.
This is an amazing piece of orthopaedic carpentry.
I'm preparing the ground by putting in taps and screws, just as one would put a screw into a piece of wood.
Professor Nordin is operating very close to Jessica's central nervous system.
We are within a few millimeters of the spinal cord. Millimeters.
There's always a risk of paralysis in any spinal surgery, so Jessica will be carefully monitored throughout by neurophysiologist Mary Curtis.
So she's got 5 corkscrew electrodes in her head, and she's probably got about 20 electrodes on her in total. This waveform here, I'm stimulating a nerve at the ankle, and I want to make sure that that signal stays the same throughout the operation.
An hour into the surgery, it's nearly time to implant the first rod.
Now we're going to cut the rod to the required length.
Now Professor Nordin must check that the growth magnet is working.
As we rotate this, we see the rod lengthening here. So we know that the mechanism is functioning. Okay, now we are going to thread the rods inside.
Jessica won't be able to feel the rods, but she should notice the difference straight away. When she wakes up, she could be as much as 3 centimetres taller. With the rod now firmly screwed in place, it's a crucial moment.
We'll be correcting most of the curvature of the spine at this stage. A limit of the correction, which is great. I mean, look at that. What a great correction. Amazing. Already. Yeah, she'll get her 3 centimetres and more.
This new technique was only licensed last year. Professor Nordin has already operated on over 100 children. It's not long before both rods are securely in place.
Well, 1.5 hours and transformation of a little girl's life.
If the surgery has gone to plan, Jessica should be out of bed tomorrow and fully active again by the summer.
And Jessica is here now with Mum Linda and consultant Mr. Hilali Nordin. Jessica, we are glad to see that you're feeling better and you've joined us tonight. Do you feel a little bit taller already?
Yeah.
Yeah, straight away. It's amazing, though, that you underwent complex surgery and, you know, Hilali, you said she'll be up and about straight away and feeling right as rain. Jessica, were you straight after the operation feeling good?
Yeah, but...
It's incredible, isn't it?
I've got to ask, Jessica, what was it like watching that? of yourself going through the surgery?
When I was about to go to the hospital, I was a bit scared.
Yeah.
But after watching this, it's not scary at all.
No. Wonderful. And Mr. Nordin, we've got to ask then, as far as the height difference is concerned, because we left that film on a little bit of a cliffhanger, what is the situation?
So we measured a 2.5-inch height difference, so we were rather pleased with ourselves. And I'm sure Jessica and her mum are also pleased with that.
Yeah, yeah. And Linda, I mean, you must have noticed other changes in your daughter, other than obviously the height difference.
Yeah, she feels happy, and, you know, she's up and about doing her own thing, and, you know, you don't get, "Mommy, my back is hurting me, my heart is hurting me" in the night. She's all right. She's happy. And,
Yeah.
you know,
And can you still bend, Jessica? Is everything like that working?
Yeah.
Yeah. And we heard in the film that you loved sport and you were a big fan of swimming. Have you been able to go back to do any sport?
I can't do physical education, which is PE. Well, I'm supposed to stay in the medical room at school, and they said if it's up to Mum and Mr. Nordine if I can go outside or not, but because of the crowds and people bumping into me.
Just got to be careful.
Yeah, of course.
Mr. Nordine, we've got to talk about this bit of kit down here because, I mean, it's unbelievable, isn't it? How frequently is this being used now?
Well, I mean, I have used it quite a bit in my patients who, essentially as an internal brace.
Yeah.
What we can do with it is, in these patients who are very young and who have still a lot of growth left, instead of doing a spinal fusion, what we can do is put this as an internal brace, lengthen it every 6 months or so, and at the end of their growth, either take it out or leave it in.
It's phenomenal to think that that is in your spine.
But, would you like me to demonstrate it?
Yes, that would be wonderful.
So why don't you come and hold it?
All right.
Here.
Okay.
Okay.
So I think, Stan, you have to stand just over here.
Yes, just make sure the cameras can see.
Yeah, no, what would you do is just hold it here.
Hold it here, right.
That's it, a little bit lower. That's it. I put a little mark in here so that you can see what we're doing. Sorry.
And then it just screws up. Yeah.
So I can feel it.
You can feel it going up.
You can feel it going up. Yes, you can feel it in your hand. You can see.
You can see, the little mark going up.
See the little mark? It's getting further and further away.